Today's video is a third installment in the video series dedicated to molecular biology behind turbo cancers. And today we're going to wrap up as to why turbo cancers happen. They're not called turbo cancers in medicine, so let's just get that out of the way right away. They are called hyperprogressive disease. So if you see fact checkers complain about, hey, there is no such thing as turbo cancers, just think of it this way: turbo cancers is a street name, or in my case, trail name, but medical term is hyperprogressive disease. So let's get started. My name is Dr. Mikhail Orashik of Genomics, and in the previous two videos, I dedicated them to the concept of IgG4 antibodies, because IgG4 antibodies are an integral component of turbo cancers. And in the reason why I'm paying attention to this is because if anyone who follows my channel, you know that I'm deeply dedicated to the topic of IgG4 antibodies, because currently we are seeing development of these antibodies in pretty much all of the mRNA vaccinated individuals, with few exceptions. So if you want to learn more about that, please check out that huge series. Now, in the previous videos dedicated to turbo cancers, we discussed how IgG4s can aid in the development of turbo cancers. And in one video, we discussed how IgG4 achieved that via its stalk. So you know how antibodies are in a shape of a letter Y. So the tips of the letter Y is how the antibodies contact whatever they're supposed to target. So whatever antibodies target, that's called antigen. So the tips of the letter Y of antibodies, IgG4 antibodies, they attack the antigen that they want to attack, or they're supposed to attack, but it's the stalk underneath that letter Y, underneath those antigen targeting fragments, that also plays important biological role. It's called Fc fragment. C stands for either crystallizable or constant, and F stands for fragment. And in one video dedicated to turbo cancers, I discussed how it is that Fc stock of IgG4 antibodies that can interact with certain type of immune cells called macrophages to transform them from the type of macrophages that you would want, which would be helping to kill cancer, into the type of macrophages you do not want, which will not kill cancers. So these are called M1, those are the ones you want, to M2, those are the ones you would not want in a cancer microenvironment. In another video by another group of authors, there's very few scientists studying turbo cancers right now, because it's very new to science, new concept to science. Turbo cancer is a very new concept to medicine as well. In that second video, we discussed how the same stalk Fc component or Fc fragment of these IgG4 antibodies can interact with other antibodies, IgG type antibodies of any kind. It doesn't matter what the IgG4 antibodies target. They can, through that Fc component, through that stalk, they can interact with stalks of other antibodies, including the antibodies that would be used to help you fight cancer. And this is another way how IgG4 antibodies could contribute towards cancer formation, turbo cancer formation. Today, we're going to add the third final element that we need in this saga in order to create turbo cancers, and that's a chemical called glutathione. This is also how this finally links. How I came across this is through my studies of vagus nerve. Remember, I'm being sponsored by a company that provides medical device for vagus nerve neuromodulation, and they're literally sponsoring me to study science and publish videos on science related to vagus nerve. That's how I ended up coming across glutathione. Why? Because vagus nerve, when you activate vagus nerve, the way I think of it, it's activating something that is very beneficial to your health. One of those benefits is glutathione. What is glutathione? Glutathione is an antioxidant. That's a good thing. Normally that thing protects you very well. By antioxidant, basically, it means it can capture and remove reactive oxygen species. It also can capture reactive nitrogen species. These are the type of chemicals that are very, very reactive, that can be good if you're fighting something like cancer or pathogens. But if you have it in your body without pathogen or cancer, it can also destroy your own tissues. So it can be dangerous, and then you can have antioxidants to clean it up and remove it from your body. So that's basically why antioxidants are good. Sometimes you need these dangerous chemicals, like I said, to fight something like cancers. And vagus nerve, one of the benefits of vagus nerve is helping to produce extra glutathione as well. Now, I can tell you that from my studies, I can tell you that I have come across certain studies that show that vagus nerve neuromodulation can be useful for helping you fight with cancer. I need to learn more about that as well. I would like to learn more from studies about that concept as well. But when it comes to turbo cancers, glutathione might not be good in conjunction with elevated IgG4 levels as well. So basically, we do know, and the authors talk about, we do know from previous studies that cancers can also elevate glutathione levels in their microenvironments as well. By the way, check out these avalanche paths behind me. That's one of the reasons why we stop here, so I can actually show you remnants of old avalanche paths. So sometimes you can see elevated glutathione in cancer microenvironments. And why would that be the case? Well, in this case, this might help cancers because glutathione, being antioxidant, it will remove the reactive oxygen species, these dangerous chemicals. It will remove it from cancer environment, and therefore these reactive dangerous chemicals are no longer fighting cancers. So sometimes cancers will want to have these antioxidants in their own environment just to protect themselves. All right, so this is how all of this links together. And the authors who've already started studying turbo cancers suspected, look, glutathione along with IgG4 might be another needed element to produce turbo cancers. And basically this is what they're going to show in the publication we're going to discuss today. It's complicated, so bear with me, okay? And so that's basically how they think it all comes together. Why? Because the turbo cancers that have been observed, especially in lung cancer patients, because remember, for the first episode that I discussed, this was how it was discovered. It was discovered via use of medication that was helping certain lung cancer patients or other cancer patients survive really dangerous cancers, but it also ended up rapidly killing certain number of cancers. No one understood why. The best understanding, it seems that there might be a genetic predisposition, and the type of genes that are involved appear to be involved in the production of glutathione or its metabolism. So this is how it's all finally being linked together as to why these cancers can become so crazy rapid in their development. So they wanted to basically test that theory. Now, why glutathione and IgG4? Of course, we still have to talk about that. Now, glutathione, as I mentioned, is an antioxidant, right? So it can capture these reactive oxygen species. How does it do that? It has a sulfur atom, and that sulfur atom will capture those reactive oxygen species because it's very reactive itself. Now, IgG4 antibodies, they're very unusual antibodies in that they are referred to in biology as anti-inflammatory antibodies. It does that because it has very unusual properties that are very different from what you typically see with antibodies. One of these super big differences is that IgG4 antibodies, that letter Y, it can split literally in half. So the antibody can be split in half, and one IgG4 antibody can come apart, another IgG4 antibody targeting something completely different can also come apart, and they can come together. So one IgG4 antibody can end up being able to target more than one antigen at the same time. Why is that anti-inflammatory? Is because if you have an antibody where the tips of the letter Y target two separate things, so this targets one antigen and this targets another antigen, sorry for the middle finger, then you cannot form clumps of whatever the antibody targets, because it targets two separate things. As a consequence of that, it reduces the capacity of such complexes being attacked by the immune system and being cleaned up. So that's one thing, it reduces the formation of complexes. Another reason why IgG4 antibodies might be anti-inflammatory is because of that Fc stock. Remember the bottom component of the antibody? Normally, these bottom components, these stocks of antibodies, is what our immune cells recognize to basically, in the end, target whatever the antibodies targeted in the first place. Because, you know, like if you have antibody binds to something, okay, great, but what happens afterwards, right? You need immune system to basically clean it up. And that happens via immune cells, such as macrophages, by being able to actually attack the complex of antibody and an insulting pathogen, be it something like a virus or a cancer cell, I should say, and you can clean it up. But with IgG4 antibodies, these stocks are not recognized very well at all by immune cells. That's another way of how IgG4 antibodies are anti-inflammatory. And right now, there's an emerging new theory that cancer cells could actually even stimulate our body in order to produce IgG4s by presenting too much antigen to the immune system and persuade our immune system to start building IgG4. Our immune system thinks, oh, hey, I need to protect the body from too much inflammation, but the cancer then takes advantage of that by having the ability to survive, because then it can use IgG4s to mask itself from recognition. Okay, so there's a hill. I don't think I can make it while skiing and video recording, so I'm gonna pause right here. Okay, so these guys did a number of different experiments to test this hypothesis, how IgG4s and glutathione can come together in the development of turbo cancer. So first, these authors, I believe they were the Italian group. I can't remember from the top of my head, but I've already covered one of their publications. They clearly worked with patients who experience turbo cancers. Again, remember, in medicine, it's called hyperprogressive disease. We're just using the term turbo cancer because, well, first of all, it has a better ring to it, and it's easier to also to say than hyperprogressive disease. And what they did is they took literally cancer cells from patients, people who had esophagus cancer, lung cancer, and colon cancer, and they implanted them in mice. And I got to tell you, these experiments I'm going to be describing, they actually can sound horrific. Basically, we're talking about doing a series of transplants into mice, and eventually these mice have to be sacrificed. These transplants are right underneath the skin. They're so close to the surface, it allows the authors to even measure how the tumor grows and so on. In this first experiment, they transferred these cancer cell lines from human patients, their own patients, into mice, and they allowed these cancers to then grow inside mice, and then they tested the microenvironments of what happened inside these mice themselves. And they were able to show that with whether it was lung cancer, esophagus cancer cell line, or colon cancer cell line, then all of that resulted in, with one exception, all of this resulted post-transplant in mice in increased levels of IgG4 antibodies in the tumor microenvironment compared to normal tissue that they were analyzing. One exception was colon cancer. They didn't see that increase, but for every other cell line they tested, and it resulted in IgG4 increase. It also resulted in an increase of glutathione in that very microenvironment, and it also led to an increase of IgG4 to total IgG ratio. And that's like also important. Remember, I made a video showing in the past that we see a ratio increase of IgG4 antibodies to IgG1 in mRNA vaccinated, but this is for spike-specific protein. So here they're showing in general IgG4 total versus IgG total. And that's the part that's dangerous, because again, that's how cancer cell lines can take advantage of. This is still yet to be determined in the mRNA vaccinated individuals, whether the total IgG4 levels increase more than IgG1 levels, and whether that ratio increases in mRNA vaccinated. So not just for spike specific, but total, where the antibodies target anything, because that potentially could signify something dangerous. But basically that's what they were seeing. Now remember, these authors previously were one of the first people showing that these IgG4 antibodies from that tumor microenvironment can bind to any other IgG antibodies. They wanted to see if that binding can be help with glutathione. So they took IgG1, immobilized IgG1 antibody, like immobilized, attached to a surface, and they were testing whether antibodies IgG4 antibodies were interacting with IgG1, and yes, they did, but they also showed that when they added glutathione, that interaction was even more enhanced. So that's another potential way of how glutathione could do this. And by the way, glutathione also is able to split the IgG4. Oh yeah, I forgot to finish telling you this. How does it do this? It's because IgG4 has sulfur atoms in its stalk, and glutathione can come in with its own sulfur and mess up this interaction between sulfur ions in the IgG4 antibody and split them apart. That's how glutathione can help the microenvironment in a cancer, by splitting the IgG4 antibodies apart. But it also, in this very last experiment I just told you, it also seems to be able to help IgG4 adopt certain three-dimensional conformations so that it helps its interaction with other antibodies. So again, not good for cancer. Okay, so then they moved on to antibodies that are used clinically in medicine. So one of them we discussed in previous videos, nivolumab, I believe it was called. I usually mess up the names because these names are so complicated. Who comes up with these names, by the way? And that's one of those medications for treatment of cancers. They're called immune checkpoint inhibitors. What they're supposed to do is they're supposed to target specific molecule called PD1, stands for programmed death 1. That's the type of molecule that cancer cells can take advantage by interacting with that molecule on T cells and make those T cells no longer properly functional. And T cells would be used to kill cancer cells. So you can see how cancer cells can basically really mess up our immune system to survive, to help cancer cells survive. This medication, you put in this medication, and it was supposed to block that interaction between cancer cells and T cells. And that's why certain cancer patients were dramatically, the chance was dramatically improved once they actually took that medication. What was done with this medication was IgG4 antibody targeting that PD1 molecule, and one of those sulfur atoms was mutated. It was exchanged to be something else, completely different amino acid, and it was believed that this would be good enough to prevent any complications. What was not properly understood and was never, well, it was simply unknown in medicine until unfortunately we discovered by accident these turbo cancers in the unfortunate cancer patients who developed them due to their unfortunate biological predispositions, is that these IgG4 antibodies were able to still induce turbo cancers. It had nothing to do with IgG4 antibodies splitting in half, because the medication that was used, these IgG4 antibodies cannot split in half, but it was because that medication could still block other interaction with other IgG antibodies. And this is what they wanted to test. So they took the medication, they took the nivolumab, I believe. They wanted to see how it interacts with antibodies and whether glutathione can enhance it. And it did enhance binding of that medication, anti-cancer medication, in the form of IgG4 antibody, and it was still interacting with other IgG1 type of antibodies. So not good, because in this way the IgG4 can literally remove antibodies that would be attacking and helping to destroy cancer. So that's the bad thing. But this is one of my favorite parts of this paper. What the authors did is that they took another clinical medication that has the same sulfur mutation, where sulfur was exchanged to something else, but it had yet another mutation on top of that. And that medication, let's see if I can remember how it is called, tislelizumab, I believe. Again, I probably got that wrong. But anyway, the reason why I like that information is because finally, that medication with those two special mutations, glutathione no longer enhance interaction between that medication and IgG1. And that's the important part, because that means we might have a solution of how to properly build that medication for future use. Because remember, that in some cancer individuals, that medication was amazingly helpful, and literally, it saved people's lives from jaws of death. That's how powerful that medication can be in the right biological context of the patient, right? So to me, that's probably the best part of this entire paper. All right, so then they moved on to another experiment. So they took another antibody that is very well known to kill cancer cells. I believe it was called cetuximab. And again, they were able to put it against immune cells and cancer cell lines, and they're able to show this antibody induces killing of cancer cells. And they were able to even show this on a photograph where they fluorescently labeled cancer cells versus in one color versus fluorescently labeled immune cells in another color. And you can see when the two colors overlap, they produce yellow color, and you can literally see how the immune cells are targeting and killing cancer cells. But the point is that when they added IgG4 or glutathione or IgG4 and glutathione, that's when the IgG4 and glutathione had the largest effect in reducing the ability of that cetuximab IgG1 antibody from killing cancer cells. So again, it just shows you the mechanism. Glutathione and IgG4 in a cancer microenvironment is bad because it can block other antibodies from effectively targeting cancer and marking it for killing by other immune cells. And they were able to show that basically when the way it reduced the cancer destruction is through the process is called complement cytotoxicity. So it's called antibody-dependent complement cytotoxicity. So complement is a system that's floating like in your blood that can help you to target pathogenic molecules or abnormal cells. And another one is antibody-dependent phagocytosis cytotoxicity. Phagocytosis means swallowing up. That's where macrophages can come in and they see the antibody complex to the insulting molecule, be it virus or cancer cell. They can swallow those components and destroy it that way. And again, IgG4 and glutathione together prevented the cetuximab cancer-killing antibody from achieving these molecular behaviors. These molecular behaviors that I just described, this cytotoxicity, they're called effector functions in biology. So the effector functions refer to specifically killing or removing anything that's toxic in our body via use of the antibodies and specific immune cells that use the antibodies to hone in on what they're supposed to destroy, okay? So they keep showing this, right? So then they moved on to another experiment, and now they took lung cancer cell lines, and once again, they transplanted them in mice under the skin, so close to the surface, they were able to measure the actual growth of tumors, and they co-injected the cancer cell lines with either solution, so this was like nothing, or IgG4 by itself, or glutathione by itself, or IgG4 and glutathione by itself. And basically these cancer cells, once you inject them in mice, they will naturally start growing, they will start producing tumor. You can see that, you can measure it, but the take-home message is that IgG4 IgG4, as we discussed previously, can induce development of a tumor, but when they co-injected IgG4 and glutathione, that's where the tumors were the biggest in size, and you can easily see those tumors in the image. We're not going to show you the mice because it looks horrific. Obviously, it's very disturbing. Seeing a tumor is different because it's just like a little blob, right? But basically, that's how they can determine that basically together, again, glutathione and IgG4 is dangerous for development of turbocancers. Now, the last experiment that I'm going to mention was the coolest one. The reason why is because it shows you how clever these scientists were. They are now recognizing what's happening here, and they wondered how common maybe this mechanism is. Is it only used for cancer cells, or could we take advantage of this mechanism that cancer cells can use to protect themselves? And could we use this in situations that would be beneficial to us, such as either organ transplant or skin graft transplant? So what they did is they did skin grafts in mice. Same idea, but instead of cancer cell lines, they did skin graft, and they moved it from, say, one area of the body to another, and they co-injected those skin grafts with either IgG4 or glutathione, or IgG4 and glutathione together, and they were basically looking the progression of how well those skin grafts did on mice. And when you co-injected IgG4 and glutathione, skin grafts did the best. You could easily see new blood vessels development under the skin graft. So they showed that under microscope how you had development of best blood network, which is important for the survival of the skin graft. And then by the end of the experiment, the skin was the nicest, the hair was the best looking on the skin graft that was co-injected with IgG4 and glutathione. So basically, their authors were saying, look, this is a universal mechanism. We technically could be taking advantage of it in the future for helping people survive, or increase the likelihood of survival of doing such medical procedures when we're putting a new foreign tissue somewhere else on the body. So that I thought was really, really cool. Now let's talk about the genetics, because clearly what the author's conclusion is, look, in these turbocancers, IgG4 and glutathione can come together. It looks like glutathione can achieve a couple things. It can, number one, split the IgG4 antibodies in half, and then you have more molecules that can potentially start negatively interacting with the immune system to help protect cancer cells. That's number one. Number two, of course, glutathione can help IgG4 either interact with the Fc component of other antibodies. So it's a Fc-Fc interaction. So Fc component, the stock of IgG4 antibody, can interact with the Fc component or a stock of another IgG antibody, usually IgG1, the ones that we would want to target the cancer, and that mechanism can be blocked now. And then, of course, IgG4s themselves have at least two mechanisms. As I mentioned, obviously, they can block antibodies and they can block macrophages by interacting with certain receptors on macrophages and inducing their transformation from M1 macrophage, which is the one we would want in a tumor microenvironment, to M2. So that's the current mechanism that's proposed in total of how turbocancers develop, but it doesn't happen in everyone. And this is the last thing that I'll mention in this video, is the genetic predispositions, because typically what you see is certain predispositions such as KRAS mutations or EGFR mutations, or they also mentioned, I believe it was SK11 and MDM2 and MDM4 mutations. And basically they mentioned these mutations all appear to be involved one way or another in glutathione, either production or metabolism. And this is why they suspect why certain individuals might develop these turbocancers, because they have abnormal molecular I guess, use of glutathione. The glutathione is not regulated properly in these individuals because they have these mutations. Now, these mutations specifically can be evolved in cancer cell lines in specific tissues. Why some cancers have specific mutations, we don't know, but it is perhaps because it might be because certain cancers have easier access to IgG4s, and therefore they might have selective pressure to evolve these mutations in order to induce this abnormal glutathione environment as well and lead to turbo cancer development. All right. I told you this is a complicated video. There's so much information to unpack, and this series on turbo cancers will continue, but basically these first 3 episodes summarize all of the molecular components that are needed in order to run the increased risk of development of turbo cancers. So number 1, of course, you need cancer. Number 2, you need elevated IgG4 levels and that can enter the tumor microenvironment. And number 3, you also need to have elevated levels of glutathione also in the tumor microenvironment. How dangerous that is from a clinical point of view in the regular population, or people who are mRNA vaccinated who are now showing higher levels of IgG4 antibodies targeting spike protein, we don't know. Hopefully, these IgG4 antibodies that are being produced in mRNA vaccinated targeting spike protein are just simply negligible in the total amount. But nevertheless, what I propose is that if you're mRNA vaccinated, do monitor your IgG4 antibody levels to make sure they do not go beyond abnormal level, and if they do, talk to your doctors as to what that might mean in terms of even potentially screening for cancer. And if you do have a cancer as well and you have an elevated IgG4 antibody levels, one possibility is to potentially look for genetic predisposition, because you might be born with genetic predisposition for those elevated glutathione levels as well, because there are options as well to remove IgG4 antibodies from our body as well. We've done a video on that topic as well. But the take-home message is that because we're seeing these unusual IgG4 antibodies in mRNA vaccinated, I think it might be wise right now to consider commencing regular checking of IgG4 antibody levels in the blood, and hopefully all will be fine. I know I've seen comments on YouTube channel from some of the vaccinated people who have been checking their IgG4 levels, and they're saying it's all normal. So that's great news, and hopefully that's exactly what we will continue seeing. But nevertheless, this is why I wanted to produce this series, because this is such an unusual connection between turbo cancers, which anecdotally supposedly are elevated, but this is only anecdotally. These are the rumors that we keep hearing. This is not yet backed by scientific evidence. And what is the connection that we might be seeing post-pandemic and turbo cancers? Well, one of those connections is IgG4. All right, please subscribe to the channel if you haven't already. This is how we grow. Please give us a like. This is also good for YouTube algorithm. Leave a comment and a share. And also finally check out our Patreon account as well, where we put additional content besides what we bring forth to the YouTube channel. And I look forward to seeing you in another installment. Bye everyone.